Honorable members, Mr. Speaker.
Honorable members, I declare this 102nd sitting of the National Assembly of the 12th Parliament of the Cooperative Republic of Guyana to be duly constituted and in session. The clerk will lead us in prayers.
Almighty God, we are here gathered together, do most humbly beseech thee to guide us in all our consultations, so that we may together build a land where knowledge is free, where the mind is without fear, and the head is set high, and where words come from the depth of truth. Grant us, O God, the aid and guidance, so that we may deal justly with the several causes that come before us, laying aside all private interests, prejudices, and personal preferences, so that the result of our counsels may be to the glory of thy blessed name, the maintenance of true religion, the preservation of justice, the safety, honor, and happiness of the President, and the peace and prosperity of Guyana. Grant us, O God, the vision so to lead, that all the people of this fair land may enter into that state of brotherhood and unity, where the mind is led forward by thee into ever-widening thought and action.
Thank you. Please be seated.
Messages from the President. Announcements by the Speaker.
Go ahead, Sean.
Presentation
Of petitions.
Go ahead.
Presentation of papers and reports, etc.
Honorable Senior Minister in the Office of the President with responsibility for finance and the public service.
Thank you very much, Mr. Speaker. I rise this morning, sir, to present to this Honorable House the following papers, reports, etc. One, the deferred payment agreement dated January 14th, 2025 between the Ministry of Finance acting on behalf of the Cooperative Republic of Guyana, represented by the Finance Secretary, and the China Road and Bridge Corporation for an amount of $162,657,139 US. And the purpose of this deferred payment agreement is to finance the upgrading of the Palmyra to Molson Creek Highway Lot 2, which covers from Bloomfield Village to number 54 Village. 2, Government Notice number 2 of 2025 regarding notification receipts of all petroleum revenues paid into the Natural Resource Fund during the period from the 1st of January to the 31st of March 2025. 3, Financing Agreement Credit number 7717GY signed on April 1st, 2025 between the Cooperative Republic of Guyana and the International Development Association for an amount of $5,400,000 special drawing rights. The purpose of this agreement is to finance the Guyana One Health project. And 4, Loan Agreement number 11, SFR-ORGY, dated April 4th, 2025, between the Cooperative Republic of Guyana, Guyana Water Inc., and the Caribbean Development Bank for an amount of $76,249,000 US. And the purpose of this agreement, Mr. Speaker, is to finance the water supply improvement project. Thank you very much, Mr. Speaker.
Thank you very much, Honorable Minister. The internet. Honorable Prime Minister.
Mr. Speaker, I rise to present to the Assembly the annual report of the Public Utilities Commission for the year 2024.
Honorable Minister of Parliamentary Affairs and Governance.
Thank you, Mr. Speaker. I have a number of reports to present to the House, so can I do them at one sweep? Thank you. I wish to present to the Assembly the audited financial statements of the Ethnic Relations Commission for the years ending 31st December 2015 to 2023, audited financial statements of the Rights of the Child Commission for the years ended 31st December 2015 to 2022, audited financial statements of the Institute of Applied Science and Technology for the year 31st December 2020. Annual reports of the Public Service Appellate Tribunal for the years ending 31st December 2020 and 2021. In the audit paper, it says audited financial statements, but it's incorrect. It's the annual reports of the PSAT for the years 20 and 21. Audited financial statements of the Public Police Service Commission for the years ending 31st December 2017, 2019, 2021, 2022, and 2023. Annual reports of the Public Police Service Commission for the years 2022 and 2023. Audited financial statements of the Environmental Protection Agency for the year ended 31st December 2019. Audited financial statements of the Guyana Lands and Surveys Commission for the years ending 31st December 2018, 2019, 2020, and 2021. Mr. Speaker, I'd like to express my deep appreciation to the Auditor General's Office, who was able to bring these reports up to date, which were outstanding, and number them for quite a number of years of constitutional bodies, and that there are more that we're tabling at the next sitting. So I wish to express my appreciation to the Auditor General for having brought us up to date on some very important constitutional bodies in particular. Thank you, sir.
Thank you, Minister. Honorable Minister of Public Works.
Mr. Speaker, I present to the Assembly audited financial statements for the Demerara Harbour Bridge Corporation for the years ending 31st of December 2021, 2022.
Thank you, Minister. Shall I just give me one more? The internet is so. Having internet troubles. Miss Honorable Member, Ms. Amanza Walton, DC.
Thank you, Mr. Speaker. Mr. Speaker, I noted that in the order paper, there was the item of the presentation of petitions. And as you're aware, there is a petition placed before the National Assembly in the name of the Guyana Human Rights Association and other concerned citizens.
Okay, just let us be technically correct at this point. It's not before the National Assembly. A petition was supposed to have been submitted to the clerk. But you can continue. Let me, just wanted to correct you.
Thank you, Mr. Speaker. A petition was submitted to the clerk of the National Assembly pursuant to his guidance. It is accompanied by a motion moved by yours truly and seconded by the Honorable Director of Finance. And that motion, that petition rather, from the Guyana Human Rights Association and other concerned citizens is specifically addressed to the National Assembly of the Cooperative Republic of Guyana from members of the Guyana Human Rights Association and other concerned citizens, and it's intituled in the matter of the tragic death.
I take notice of what you have mentioned, and I just wanted to reaffirm the National Assembly of the process for petitions, right? So, the Honorable Member, Ms. Amanza Walton, desired that she was going to present a petition on behalf of the Guyana Human Rights Association. The standing orders relating to the position says that petition should come to the clerk, who will review it against the criteria which he has, and then forward a recommendation to the Speaker for it to go on the order paper. The physical petition, I should say not only the physical, but, and I consider electronic transmission to me, submission, came in at 9:32 a.m. this morning. At that time, the clerk was on his way here, like most of you, tied up in the congestion we've had. And when we met, the clerk hadn't had an opportunity to review that petition, so it wasn't able to make it onto the order paper. So just to reaffirm that a petition was submitted to the clerk, but no submission to the Speaker for onward transmission on the order paper. And this is one of the reasons why we were a little delayed in calling
Mr. Speaker, thank
Isaac?
you for that clarification. And I am confirming, therefore, that you're saying that the petition filed by the Guyana Human Rights Association in the matter of the tragic death of Miss Adriana Young is
We're talking here of the process of petitions getting onto the National Assembly.
Mr. Speaker, I am aware. I am aware of what we're speaking, and so I am confirming that this is before the clerk for his review. And respectfully, I ask, Mr. Speaker, when can we, as members of Parliament, when can the Guyanese public and the Human Rights Association receive a response from this Honorable House on this matter, given that this is something of significant
Honorable
national
Member,
import?
with respect to petitions, the standing order is quite clear. When a petition is presented, there are three options. One, it could be read, it could be circulated to members, or it could be moved to go to a special select committee. Am I in order, dear Mr. Clerk? Right? So we await the clerk's review and his recommendation to us.
Thank you, Mr. Chair.
Thank you.
Reports from committees. Oral questions without notice.
Honorable members, there are 9 questions on today's order paper. Sorry, we had an oral question without notice submitted by the honorable member, Ms. Amanza Walton Desir.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Honorable Minister of Home Affairs.
No, I'm not asking you to push. I just want to
sorry.
put the question. I just
Yes.
wanted you to relate what you sent because I have to rule on the submission.
Yeah, Mr. Chair, I had submitted to you for your attention a question for the Honorable Minister of Home Affairs, and it's couched in the context of the Private Security Services Act, particularly the Section 17(1), which regards the use of uniforms by private security agents. And my question to the Honorable Minister was, in the context of that provision, whether permission, because Section 17 requires that permission for uniforms and identification, etc., must be given by the controlling authority. And my question to the Honorable Minister was whether any permissions were given, particularly with reference to special uniform and special caps and the outfitting of private security agencies, whether permission has been given to any security agency for the wearing of masks, of ski masks or balaclavas.
Honorable members, I received the question and read it against the standing orders which said such questions for oral questions without notice should meet 2 criteria: 1, importance, and 2, urgency. And I felt that this question would best be presented as a question in written form regularly, while I don't see the urgency of it at this time.
Mr. Speaker, if I may, I acknowledge your guidance, but I want to add very briefly that I am not sure how this cannot meet the requirement of urgency. The entire Guyana saw over the last few days, particularly on the west coast of the west bank of Demerara, where there was a confrontation between a crowd of protesters and a private security firm. And the members of the private security firm, armed to the teeth, were all wearing ski masks and balaclavas, unidentifiable. Mr. Speaker, we are in a time right now where protests abound. How are we to understand who these people are? The Guyana police, they're not law enforcement. And so for me, it is a question that is very simple, and it is a yes or no answer.
And while it might be simple, it's important, and the urgency criterion at this point, in my view, then make it qualifying
Mr.
for
Speaker, I
this.
want to put on record.
Thank you very much, honorable member. We need to move on.
One more issue. I wish to put on record that if tomorrow a mass...
Honorable member, please. Honorable member. Sherlock, Mr. Clerk, please.
Questions on notice.
Honorable members, there are 9 questions on today's order paper. Questions numbers 1 to 5 are for written replies, and questions numbers 6 to 9 are for oral replies. For written replies, questions 1 to 3 are in the name of the Honorable Member, Ms. Annette Ferguson, and are for the Honorable Minister of Home Affairs. Question number 4 is in the name of the Honorable Member, Ms. Annette Ferguson, and is for the Honorable Member, Minister of Tourism, Industry and
Coming up, oh, now it is.
Thank
Sorry,
you,
Mr. Speaker.
Minister Teixeira.
She has asked me to defer as she's not in the country.
Thank you. Question number 4, we'll defer that answer until the Honorable Minister is able to submit that when she returns. Question number 5 is in the name of the Honorable Member, Ms. Annette Ferguson, and is for the Honorable Minister of Housing and Water. The answers to these questions, except question number 4, have been received and have therefore been circulated in accordance with our standing orders. For oral answers, question number 6, 7, and 8 are in the name of the Honorable Member, Ms. Tabitha Sarabo Hali, and are for the Honorable Minister of Labour. Honorable Member, Ms. Sarabo Hali, on question number 6, you may ask the Minister your question.
Thank you, Mr. Speaker. Mr. Speaker, can I indulge this National Assembly by asking that we take 1 minute of silence for Adriana Young, following her what has transpired over the last couple of days. Just 1 minute, sir. Is that something that we can do, please?
Unfortunately, I need to have you ask question number 6 of the Minister. We're going to get to that matter later on.
Thank you, Mr. Speaker. Number 6 question. Can the Honourable Minister state whether there has been any collaboration between the Ministry of the Public Service and the Ministry of Labour to conduct a formal needs assessment of the current and future skills needed for the public service and the country?
Honourable Minister.
Thank you very much, Mr. Speaker. The answer to the specific question is no. What I can say to the National Assembly that we have a consultant in-house at the Ministry of Labour that is presently working with all government agencies and ministry to assimilate the necessary information as regards the public service and its present and future staffing.
Honourable Member, Ms. Hali.
Thank you, Mr. Speaker. Can the Honourable Minister please state what was the timeline given to the contracted person to get to the consultant, to deal with this particular issue, and when can we expect some sort of results from that?
Minister.
Okay, so the consultant is at the ministry on a 3-year contract. I think the contract will be up next year, so 2 years of work has already been done. As regards the definitive timeline, that I will have to get to the National Assembly after consultation with the consultants and the senior functionaries of the Ministry of Labour.
Thank you, Minister. Ms. Hali, you can put question number 7.
Thank you, Mr. Speaker. This question number 7 is for the Minister of Home Affairs. Can the Honourable Minister state what is the number of registered Venezuelans in Guyana as of November 2024?
Minister. Minister, question number 7.
Thank you, Mr. Speaker, and I want to thank the honourable member for her question. The number of Venezuelans registered for the period October 1 to 30th of November 2024 amongst the 15,157 by regions: 1, 7,507, Region 4, 23, Region 7, 1,101, and Region 8, 65.
Thank you, Minister. Ms. Halley?
Mr. Speaker, can the Honourable Minister please confirm number four's number, Regions 4's number? I didn't hear it
Minister?
clearly, sir.
Yeah, we're looking at the
I said-
volume. I just
I said
signaled them
23.
because I didn't hear properly.
Mr. Speaker, he spoke when you spoke. I didn't hear him.
Minister?
Mr. Speaker, I was specifically asked for a period, and I gave it by region for the totals of for 15,157. I can share with the honorable member the reply to satisfy her with what I said was the number for Region 4.
Ms. Halley?
Mr. Speaker, I'm trying to, I'm really not trying to be facetious. I'm just trying to understand what information I'm receiving from the minister. The question stated as of November 2024, which means 2020, 2021, 2022, 2023, up to November 2024, because that's when the question was submitted. So is the minister saying that as at November 2024, there are 15,000 registered Venezuelans in Guyana?
Mr. Speaker, the answer as I gave it and I read it. As of the 4th of October 2018 to the 30th of November 2024, and I repeat, by region, 1, 7,507, 4, 23, 7, 1,101, and region 8, 65, totaling 15,157. Yeah.
Ms. Halley?
Mr. Speaker, Mr. Speaker, those numbers do not add up to 15,000. I don't know, I'm really, that's what the minister's, I'm just supposed to accept it because he said it. Okay, all right. But the world heard that apparently the minister can't add. So let's move on. Can I go to question number 8, please, sir?
You may put question number 8 on.
Oh, sorry.
Mr. Speaker, can I ask a follow-up?
Honorable Mr. Patterson.
So, sir, I heard the Honorable Minister, he's saying from 2018 to 2024, 6-year period that we only have 15,157 registered Venezuelans in the country, sir. Then he disaggregated it, and so I added it up, and that comes up to 8,596. The numbers he gave us with region 1, 4, 7, and 8. Can I ask the Honorable Minister where the other 7,000 Venezuelans reside?
Honorable Minister.
Mr. Speaker, let me apologize for some inadvertence in the numbers. I will confirm the numbers and submit them as a printed reply.
Thank you, Honorable Minister. Honorable Member Ms. Halley, question number 8.
Mr. Speaker, maybe this question may help us to clarify what we weren't able to get at 7. Can the Honourable Minister state what is the monthly number of arrivals of Venezuela in Guyana? From January 2024 to present and their points of entry.
Honorable Minister.
Mr. Speaker, I want to ask the Parliament's leave to review and confirm these numbers again before making further reply on these questions.
Thank you, Minister. Honorable members, we can move to question number 9. The Honorable Member, Dr. Karen Cummings, you may ask your question.
Thank you, Mr. Speaker. Can the Honorable Minister Health inform the National Assembly whether high-risk mothers in Guyana can rely on the emergency care available and delivered at the health facilities in the 10 administrative regions?
Honorable Minister.
Thank you very much, Mr. Speaker. And let me thank the honorable member for her question. The short answer can be yes, but I want to also say that the way that we determine whether a mother is at high risk or not is that we look at the maternal age, so whether somebody is below the ages of 16 or above 35. We also look at the obstetric history, and there are lots of different things that we look at, including whether they had more than 5 or more deliveries, whether they are giving birth for the first time, whether they had a previous stillbirth or a neonatal death, whether they had previous miscarriages, whether they had a preterm birth or a low birth weight baby, whether they had a previous cesarean section, a history of postpartum hemorrhage, a history of pre-eclampsia or eclampsia, and of course we also take into consideration the current pregnancy, whether it's multiple pregnancy, whether they had bleeding in the current pregnancy, whether they have a suspected or confirmed abnormal fetal growth, whether there's a breech presentation, and whether they have severe anemia. And there are some other conditions too that we look at. We also would assess the mother to see whether she has hypertension, which is probably chronic or due to the pregnancy, whether or not she has diabetes, a pre-existing condition, or gestational diabetes, whether she has heart disease, kidney disease, sickle cell, asthma, HIV or STIs, a history of TB, or any mental health conditions. Infectious diseases, we also screen for malaria, dengue, Zika, and HIV. And we also look at social and nutritional factors, social being looking at whether there's substance use, including alcohol, tobacco, and drugs, and so forth. So using this as a way of screening, one of the things that all our health facilities look for is early identification. We also do timely referral if we find somebody at risk, and if they're at risk and we do the referral, they'll get continuous specialized care, and we ensure that this mother delivers in a hospital. And we do also comprehensive postnatal follow-ups. Mr. Speaker, over the last couple of years, we have been able to do a number of things that would have enhanced the quality of care that we have been delivering. So, for example, in most of our regions, we have added new theaters where, if necessary, we can do cesarean sections and delivery. And those theaters include, in Region 1, we have added a new theater at Mabaruma, we have added a new theater in Kumaka, we have added a new theater in Port Kaituma. We also have added here on the East Bank, a theater at Diamond. We have in Region 5 a new operating theater at Maikoni. We have also added one at Camarang, one at Madhya, one at Aishalton, Anai, Karasabai, and we have at Sand Creek, and we are soon to complete one at Kukwani. And this does not include the existing theaters that we have in our existing regional hospitals, such as Sadi, West Demerara, the Georgetown Hospital, which is our tertiary facility, the Amsterdam, the Linden. In addition, in terms of theater capacity, another and each of these, there will be a birthing suite, and if necessary, there are also 3 operating theaters that would be there. So in terms of facilities, we have adequate facilities. And those places that I mentioned, those theaters was built in the last 2 to 3 years and open and have been operational. In addition to that, Mr. Speaker, we also have built a number of maternal waiting homes. So persons who are at risk, they would come to these waiting homes and wait there until they go into labor, and then they come across to the hospital. And we have waiting homes now at Mabaruma, that's a 14-bed facility. Komaka, where we have a 20-bed facility. We have a waiting home at Long Creek, a 5-bed facility. One at Kato, which is 16 beds. A facility at Lethem, which is 40 beds. And one at Anai, which is 20 beds. And we are going to continue this to add waiting homes to our various regional hospitals. In addition to that, Mr. Speaker, in terms of the personnel that we have at these sites, across the region, we have 17 specialists supported by registrars and GMO. We have another 30 persons who specialize in obstetrics care. But obstetrics care, Mr. Speaker, is not just about the mother, it is also about the neonate. And one of the things that we have done over the last couple of years is to improve neonatal care across the country. We have set up an NICU at Mabaruma Hospital. This was started in 2023. We have also set up one at Komaka, which was also started in 2023. Another one at the public hospital, Sadi. Another one at West Demerara Hospital. At the New Amsterdam Hospital, we have expanded the NICU there. This is part of what the question entails, whether we can provide emergency care. If you don't understand the thing, I can explain that to you. Bartica, we have also added an NICU. Lethem, we have added another NICU there. These places, Mr. Speaker, did not previously had NICUs, and we of course have one in Linden. And to look after these children, Mr. Speaker, we have 13 consultants that are spread across the different regions, and they are supported by an additional 33 registrars and GMOs. So I hope that answers the honorable member's question. Thank you very much.
Thank you, Minister.
Dr.
Cummings.
Yes, I just want to thank the Minister for what may appear a comprehensive answer. But I just want the Minister to know that that's all well and good. We were there in our term, we started waiting homes and so forth, which is good, and you've continued it. But the point is the monitoring part. It's the monitoring part that it's really account for some of these deaths, which are preventable. you know? So you can't be sending home what you should be keeping and keeping what you should send home. So those kind of, you know, just to tweak those areas. I know you're making effort, the Department of Maternal Child Health, I know they're trying, and but just that to focus on that particular areas, because when you ask an interview of the patients and the parents and the relatives of those who would have gone to like the New Amsterdam hospital and so forth, those are some of the things they you know, the attention wasn't there, they weren't properly monitored. So in all that you're doing in terms of infrastructure, you know, and trying, you know, to maintain the training, but the monitoring you need to spend some time on. Thank you very much.
Honorable Minister.
Thank you very much, Mr. Speaker. Again, I'm not too sure what the honorable member is referring to there. So let's have something very clear. Indeed, the last government, there was an IDB program that looked at maternal and child health. And this was borrowings that they had from the IDB. And one of the components of that program was to look at the development of waiting homes. But under the last government, not a single waiting home was developed with that money. It took the PPP to come into government, and the first one we opened, it let him. So I'm not sure what waiting home you're talking about, because zero was opened under the APNU AFC. And we should recognize that. You had the money, but you did nothing with it. Zero was open. So let's get that very clear. The other thing in terms of monitoring, every single mother that comes for care to us, if they come in during their 9 months, we at least want to ensure that every mother has at least 8 visits. The first visit in the first trimester, 3 in the second trimester, and the rest in the third trimester. If they're at high risk, we would encourage them to come even more often, and we make sure that we monitor them. And I have a whole list here. I can go through this. All the things that we do. And every single test that we do for every single mother that comes through our system. So we should be proud of this system, because this is helping to keep women safe during pregnancy. We should be proud of it. Thank you very much.
Thank you, Minister. Mr. Clerk.
Statements by ministers, including policy statements. Personal explanations. Requests for leave to move the adjournment of the National Assembly on definite matters of urgent public importance. Motions relating to the business.
Relating to a request to move the adjournment of the Assembly on definite matters of urgent and public importance from the Honorable Member, Mr. Jermaine Figuera. I'll ask him to state his issue.
Thank you, Mr. Speaker, for your accommodation. I'm about to present a motion for the establishment of a national child emergency notification system. But, Mr. Speaker, it would be remiss of me if I did not seek your permission in asking that all members of this House stand with me for a minute of silence for the tragic and horrendous loss of lives in such a short span of time in Guyana. For 2 Londoners, Ronaldo Peters and Keon Pujane, and for the recent 11-year-old Adriana Young, in which this motion I'm about to present seeks to honor.
I concur with you. Let's stand for a few moments. Thank you.
Thank you, Mr. Speaker. Thank you to all members of this House. Mr. Speaker, this motion reads, whereas the tragic and brutal abduction and murder of 11-year-old Adriana Young has shaken the collective conscience of our people of Guyana, transcending all ethnic, religious, and social divides. And whereas there is a national outcry for urgent reform to enhance child protection and strengthen public safety mechanisms. And whereas experiences in other jurisdictions, including United States, Canada, the European Union, have demonstrated the effectiveness of child emergency alert systems, such as the Amber Alert, in facilitating the rapid recovery of missing children and saving lives. And whereas the swift dissemination of critical information to the public through mobile devices, media outlets, and public networks have proven to dramatically improve child recovery rates and deter criminal activities against minors. And whereas Guyana, as the fastest growing economy in the world, must proactively implement security measures to protect its most vulnerable citizens, especially its children, amidst increasing exposure to criminal elements. And whereas the establishment of a national child alert system will not only improve law enforcement's ability to respond promptly to child abduction, but would also empower the general public to actively participate in safeguarding our children. And whereas the implementation of a national child alert system would stand as a lasting and meaningful tribute to the memory of Adriana Young, ensuring her life and untimely passing serve as catalyst for lasting national protection reforms. Be it resolved that this National Assembly calls on the government of Guyana to immediately begin consultations with stakeholders, including the Guyana Police Force, telecommunication providers, civil society organizations, and child rights activists, to design and implement a national child emergency notification system. Be it further resolved that within 6 months, the necessary legislation and regulations be drafted and tabled to establish the operational framework, responsibilities, and protocols to govern the national child alert system. Be it further resolved that the system be named the Adriana Alert System in honor of Adriana, to symbolize Guyana's commitment to the protection of every child within its borders. Further, be it resolved that annual reports on the system's activation, effectiveness, and outcomes be laid before the National Assembly to ensure transparency, accountability, and continuous improvement. Mr. Speaker, I am usually a strong emotional person, and I have witnessed that. I have buried family members dear to me, close friends and associates, and on few occasions, Mr. Speaker, I seldomly shed a tear publicly. But Mr. Speaker, I saw, like many Guyanese, and I'm confident that you and all of us here in this house equally witnessed the emotional anguish of those parents who lost their child in such barbaric manner. But what got me in an emotional state, Mr. Speaker, is when I saw, like you, when I saw, like many Guyanese, Mr. Speaker, Adriana's father, a man who without doubt loved his daughter, jumped into the pool, Mr. Speaker, and grabbed his lifeless baby girl. Mr. Speaker, the cry he cried out is a cry of only who feels it knows it. That got to me. I want to believe it got to you too. I believe it equally resonated with you as other Guyanese home and in the diaspora. Mr. Speaker, the tragic abduction and murder of 11-year-old Adriana Young has profoundly shaken the consciousness of this country. And again, I say it transcended ethnic, religious, and social divide. This grievous loss demands not only solemn remembrance, but decisive action for justice. Mr. Speaker, it is in her honor this motion is being proposed for serious consideration that Guyana adopts a national emergency response system for missing children modeled after the United States Amber Alert, amply named the Adriana Alert System. Mr. Speaker, such a system would significantly enhance child protection mechanism, foster public vigilance, and deter potential predators. Mr. Speaker, in the context of Guyana's rapid economic growth and increasing attractiveness to both investors and criminal elements, the implementation of an Adriana Alert system is not merely necessary, but most urgent. Mr. Speaker, it is in this regard I put it to you, I put it to this House, that there is urgent need for immediate reform and legislation. Mr. Speaker, the gruesome murder of Adriana Young underscores glaring gaps in Guyana's current child protection and the Guyana Police Emergency Response Framework. Mr. Speaker, it did not go unnoticed that while this proposed motion was made public, it resulted in the Office of the Commissioner of Police of the Guyana Police Force putting out a statement of its standard operating procedures with regards to missing children and persons which essentially said they do have ways and means of dealing with this already. Mr. Speaker, it is with the greatest of respect to the efforts of the good men, our good men and women in the Guyana Police Force. It should be known that what this motion seeks to promote is not to compete with the Guyana Police Force, but to complement and improve its efforts for greater effectiveness and reliability. Mr. Speaker, the police must come to the consciousness that their present efforts and action with this very sad circumstance has resulted in the loss and death of a Guyanese child, a niece, a student, a friend, a neighbor, a daughter. The people of Guyana demands more, Mr. Speaker, from our people in uniform. Clearly, Mr. Speaker, the reliance solely on traditional investigative techniques used by the Guyana Police Force is insufficient in a rapidly digitizing and expanding society. Mr. Speaker, most will agree that there is too much loopholes in this Babylon system where trust and confidence in the police has to be restored. The Guyana Police Force has to do more to be considered professional, independent, and it has to rid itself of some individuals, criminals, Mr. Speaker, in uniforms, giving shelter under the forces umbrella. Mr. Speaker, as the fastest economy in the world, Guyana's infrastructural, technological, and legislative advancements must be paralleled by much needed reforms in public safety as of the developed world, particularly when it comes to the safety of our most vulnerable, our children. Mr. Speaker, this proposed idea which embodies this motion is nothing new. It already exists. Sir, in the United States, the AMBER, America's Missing Broadcast Emergency Response Alert System, has proven instrumental in saving thousands of lives since its inception in 1996. Thousands of children have successfully recovered as a direct result of the system. Mr. Speaker, the Amber Alert operates by broadcasting in real-time information about abducted children across all communication platforms, including smartphones, that almost every citizen has. It is the cell phones of ordinary Guyanese, Mr. Speaker, that folded the continuation of the plotters of that wicked and devious plan. And I want to publicly thank our women and all the people who stood their ground and fought for answers. Additionally, Mr. Speaker, this system also utilizes radio, television, and highway signs within minutes of confirmed reports. This massive, immediate dissemination empowers the public, the citizenry, our ordinary Guyanese to become active participants in child recovery efforts, vastly expanding eyes and ears available to law enforcement, who most certainly need help, Mr. Speaker. Mr. Speaker, Guyana, with its steadily increasing mobile phone penetration and growing access to internet services, is in a strong position for us as a country to leverage similar technology. Mr. Speaker, an Adriana alert system would serve to immediately notify citizens nationwide of child abductions, sharing critical information such as descriptions, suspected vehicles, and last known location. It would transform the entire population into potential first responders, significantly increasing the odds of recovery during crucial early hours following a disappearance. Mr. Speaker, countries like the United States, Canada, and in Europe, such alert system proved very effective in its recovery rates of children and missing persons. In each of these contexts, the existence of an immediate alert system not only aids in rapid recovery, but acts as deterrent. Criminals are aware that any abduction triggers a nationwide alert system, Mr. Speaker, drastically reducing their opportunities to evade capture. Mr. Speaker, beyond practical outcomes, the institution of this Adriana alert system would have profound societal impact. It would send an unequivocal message that the safety of the children of this country is a national priority, reinforcing communal responsibility and moral vigilance. Moreover, Mr. Speaker, it would honor the memory of Adriana Young by ensuring that no other child falls victim to similar horrors without an immediate and powerful collective Guyanese response. Mr. Speaker, such a system also cultivates trust between the public and law enforcement. In an era where police reform is both necessary and increasingly demanded by our citizens, fostering collaborative engagements through an Adriana alert system would rebuild confidence and strengthen public safety partnerships. Mr. Speaker, we are of the firm view that Parliament, this House, sir, must enact specific legislation authorizing the creation and management of a system, setting criteria for issuing alerts. Further, telecommunication providers must facilitate automatic mobile notifications, as well as integration with radio, television, and social media platforms. Law enforcement and emergency responders must receive specialized training. Simultaneously, public education campaigns must prepare our citizens to understand and respond to alerts appropriately. And as we must ensure the system is verified with regards to child abduction to prevent the dissemination of false information, and more so to maintain public trust. Mr. Speaker, as I conclude, I must reiterate the implementation of Adriana alert system would immortalize Adriana Young's memory, not through words alone, but through concrete life-saving action. It would symbolize the nation's collective commitment to safeguarding its future, the children of Guyana, and demonstrate that from tragedy can arise transformative progress. Sir, Guyana is at a pivotal moment. Its unprecedented economic growth brings new threats, and without proactive measures, the most vulnerable will pay the heaviest price. Again, I say, by instituting Adriana alert system, Guyana, Mr. Speaker, our country would play a leading role in the Caribbean and Latin America in child protection innovation, setting a powerful example of how a nation can and must unite in defense of its children. I thank you.
Honorable Prime Minister.
Mr. Speaker, thank you. All of us, Mr. Speaker, wants to get to the bottom of this occurrence that led to the death of little Adriana Young. While together we mourn as a country, we've already taken action as a government to facilitate the independent inquiry. Today, as all of us, Mr. Speaker, should know by now that we have in progress the post-mortem, Mr. Speaker, being conducted by independent, Mr. Speaker. No, we got into debate. Mr. Speaker, I wish to...
Honorable Prime Minister, let's hear the Opposition Chief Whip.
Thank you, Mr. Speaker. My apologies, PM. Mr. Speaker, just for clarity, has the motion been accepted and are we now into the debate?
As a matter of clarity, this is not only a very sensitive matter, it is one that we all need to put our positions. Normally such presentations from the move of the motion takes about 2 minutes. And I allowed the honorable member who has proposed the motion to make a full presentation. It's only fair I allow the Prime Minister to say what's happening.
But Mr. Speaker, I applaud you for allowing the Speaker the member to go beyond the 2 minutes. But that being said, he presented a motion, and in order for us to continue, it has to either be accepted or denied.
We have done this before. I have a number of years' experience in this house, and all items under the standing orders. Honorable Prime Minister, you may continue.
Mr. Speaker,
Mr.
I wish
Speaker,
to
this is
bring...
unacceptable, and we will not party this.
Mr. Speaker,
Well, you may continue. The microphone.
Mr. Speaker, I wish to bring to the attention of the House a document dated the 25th of April 2025, prepared and disseminated by the Guyana Police Force, handling reports of missing children, persons, standard operating procedure. And in this document, all the changes that are necessary is incorporated in this document, Mr. Speaker. And for the purpose of the House, I shall state the important aspects, the key provisions of this new policy that is prepared by the Guyana Police Force. Immediate response. All missing person reports must be acted upon without delay. This is a major change from before, where we had a mandatory 24-hour waiting period. Now, all missing person reports must be acted upon without delay. Activation of red alerts. A red alert will be immediately issued for any report involving a missing child, triggering a national coordinated response. Risk classification. Special attention will be given to children, elderly individuals, and persons with disabilities or vulnerabilities who will be classified as high risk, warranting immediate deployment of additional resources. And interagency coordination. The force will continue to work collaboratively with the Child Care and Protection Agency, Immigration Department, health institutions, shelters, and other critical partners to ensure a comprehensive and effective response. Public awareness. The Corporate Communications Unit of the Force will disseminate timely and accurate public notices regarding missing persons upon authorization from the Office of the Commissioner. Senior oversight and accountability. Divisional commanders and the Missing Children Persons Unit, MCPU, will maintain daily oversight of all active investigations and provide regular updates until each case is resolved. Additionally, the heads of services, including the Chief of Defense Staff, Chief Fire Officer, and Director of Prison, will be notified promptly by the Commissioner of Police in all cases involving missing children or vulnerable individuals. Mr. Speaker, this new SOP will be gazetted on the 29th of April, that is tomorrow. And Mr. Speaker, I wish to remind this House that even before these changes, we already had a Child Care and Protection Agency that falls under the ambit of the Ministry of Human Services and Social Security that has already been exercising responsibility for the protection and welfare of children throughout the length and breadth of Guyana. Its actions are governed by the 2009 Child Protection Act. Mr. Speaker, within the last 4 years, the Ministry of Human Services and Social Security launched the Every Child Safe program, which continues and encompasses the following to develop safer communities: training of civil society and children in all communities on keeping children safe by recognizing the signs of abuse and having a low threshold for reporting instances of abuse. Directly working with children to apprise them of the laws and also to encourage reporting. Addition of 914 hotline in addition to a dedicated child protection hotline to increase reporting of cases of child abuse, the removal of children to shelters or state care to offer protection, the provision of socioeconomic, psychosocial support to all children who experience abuse, including trauma, focused counseling included, the continued training of CPA personnel to deliver services to children in all the support areas, including grief and resiliency. And I'm aware that such action is taken where today we have a unit from the CPA is currently at the school attended by little Adriana Young. Ministry of Education, they are at the school attending to this whole issue of grief and counseling for the students at the school attended by little Adriana Young. A parenting program to work with parents on care of children and to prevent abuse across communities. Training of persons across all regions who run daycare on child protection in addition to early childhood development. Collaborative work with the sexual offenses DV unit to tackle violence in schools, going into schools and working with children. The increased subvention to NGOs to establish child advocacy centers in all regions. The passage of the Family Violence Act, which also protects children. The Streetlight Program, which removes children off the street and offers protection and care. Through the Family Enhancement Services Unit, development program with support and training from USAID to work with youth at risk and their families and to prevent delinquent behavior and intervene where juveniles are most vulnerable. The development of a rapid response program to respond immediately to reports of child abuse. The Community Clean Sweep program to go into communities and unearth and address all cases of child abuse with a dedicated team. The anti-bullying and anti-body shaming programs and campaigns. The expansion of the foster care program to place children in home environments to have safety, security, and love. Training of the police and persons in other agencies in a dedicated effort on the Child Protection Act, the Teen Pregnancy Prevention and Protection Programs. These are all initiatives that are geared towards protecting our children. Mr. Speaker, I take this opportunity to remind the House that our government have been making policies and implementing programs throughout the length and breadth of Guyana to safeguard our children. From an economic standpoint, we have the Because We Care cash grant. We have the payment for newborns. New schools are constructed. New children advocacy centers are being constructed, and hope and justice centers. Hotlines to report child abuse and domestic violence. New Family Violence Act. New Combating and Trafficking Act. Family Court. Health programs for eyeglasses. These are all measures aimed at helping our children. New hospitals and upgrading of equipment and services at health facilities across the country, including telemedicine. Training of police to handle children and domestic and sexual abuses report. These are all aimed at improving the welfare and the protection of our children, Mr. Speaker. This is my response in regards to the honorable member's motion, Mr. Speaker. Thank you.
Thank you very much, Honorable Prime Minister. Honorable members, what I have done here this morning with respect to allowing the mover of this motion and a response from the government is not unique in this House. And we have had it before. The matter of the death of Adriana Young, as the Honorable Member Mr. Figueroa mentioned, touches all of us. But we still have to come to the crux of his motion, which calls on the government to do certain things. And after I've read the standard operating procedures that were first released by the Guyana Police Force on Saturday, even before I received his notice, I felt that the government did move with urgency on this important issue of dealing with missing children and alerts being made. I want to highly commend the government for the swift action in establishing these new standard operating procedures. I trust that we will have to do more. Public pools will have to have even more regulations. Once you're opening your swimming area and having come from that sector, we will have to deal with lifeguards permanently and a number of other safety, not only for children, but for the patrons using it. But specifically with respect to the resolution of the Honorable Member Mr. Figueroa, the government has acted, is acting, and in this regard, it would be difficult for me to allow the motion to be discussed at this sitting. Mr. Clerk?
Motions relating to the business or sittings of the National Assembly and moved by Minister. Introduction of bills.
Honorable Prime Minister.
Mr. Speaker, I present to the Assembly the Oil Pollution Prevention, Preparedness, Response and Responsibility Bill 2025, Bill number 7 of 2025, a bill entitled An Act to Make Provision for Preventative, Restorative and Compensatory Measures in relation to oil spill incidents in the national territory, particularly the prevention of pollution from oil, oil spill preparedness, response, cooperation, and financial responsibility, the establishment of the competent national authority, and for related matters. And I move that the bill be read the first time.
Thank you, Prime Minister. Honourable members, Mr. Clerk, let the bill be read a first time.
Oil Pollution Prevention, Preparedness, Response and Responsibility Bill 2025, Bill number 7 of 2025. Public business, government's business.
Honourable members, let us take a suspension at this time and we'll be back in 1 hour.